The reminders that COVID is ever present are inescapable in Leicester, one of the areas where the so-called Indian variant is now the dominant strain. To prevent infection, the injection. Thousands more are getting their COVID jabs. But for those on the front line of this crisis, it may not be a voluntary decision for much longer. The government could make it compulsory.
It would be incumbent on any responsible government to have the debate, to do the thinking as to how we go about protecting the most vulnerable by making sure that those who look after them are vaccinated.
It may become a condition of employment. 83% of frontline healthcare workers in England have had their first dose, but the government says to reduce the risk of transmission on hospital wards, that figure needs to be much higher, with over 57,000 members of staff not having had their vaccine yet. It's thought hesitancy over the jab may have a part to play. Dr. Julian Tang has both had COVID-19 and been involved in the fight against it. He says cultural nervousness is still an issue. Forcing people isn't the answer.
I think that healthcare workers should be vaccinated to protect them from the virus, from the infection, that they could then pass to their patients. But again, compulsory is a difficult word. You can't force people to be vaccinated. The best you can do, and what I've been doing, is trying to persuade them with factual arguments about why it's safer to get vaccinated.
It's as the NHS is struggling in some areas to manage the unprecedented backlog of patients caused by the pandemic. In the West Country, the ambulance service declared a critical incident, but are prioritising the most severe cases. It's a similar picture across the nation.
We've got people who we think have held off from coming in, but it's now got to a point, their illness or their condition, that they really do have to have treatment. But when they turn up to A&E, we're having to admit larger numbers of people than we normally would at this time of year, and they're needing complex and longer treatment.
A consultation on the mandatory immunising of care home workers closed only a few days ago. The same process may start for hospital staff soon. They've spent the past 16 months protecting us. Now they might not get a choice on whether to protect themselves. Ashna Harinag, Sky News in Leicester.